Hello, my name is Neil Baum, and this is the first of a two-part series on improving compliance for our patients and hoping that they will follow our instructions regarding their medication. Why was this topic selected? I was shocked to find out that there are 125,000 deaths per year as a result of poor compliance. To put that into a urologic perspective, if there are 30,000 deaths from prostate cancer, 40,000 deaths from auto accidents, and 50,000 deaths of Americans who died in Vietnam, that's still less than the 125,000 deaths as a result of poor compliance. Another visual to understand how large that number is. If the audience for watching Elton John at Dodger Stadium in 1975, there were 125,000 people in that audience, same number that die every year as a result of poor compliance. Let me share a true story from my practice. I was once treating a man with prostatitis with ciprofloxacin, and I got called to the intensive care unit thinking that he needed a catheter. Didn't have a catheter in, and I called the referring doctor and asked what was the reason for my being consulted. The patient was on theophylline, and when I gave him ciprofloxacin, he got a untoward reaction or a drug-drug interaction between theophylline and ciprofloxacin, whereas the cipro significantly increased the blood level of theophylline, causing severe respiratory distress. That certainly got my attention, and it made me realize how important these drug-drug interactions could be. So in this 5 to 7 minute presentation, I will share with you why medication compliance is important and suggestions for improving compliance. In the second video, I'll talk to you about the future of compliance as we go forward. There are multiple reasons for non-compliance. Certainly one of the most important, particularly in senior citizens on limited incomes, is trying to save money. This slide shows, as we well know, that the United States leads the economic countries regarding costs of medication, where ours is absolutely the highest. So, as Chris Como says when he starts his program Prime Time, let's get after it. As Americans, we are over-medicated, particularly the seniors are often taking more than 5 medications per day. So I'm suggesting we deep six those amber vials, and no longer will we need to have somebody take in the data or all those medications that they're on when we take their history. One of the ways we can do that is by supplying patients a wallet card, that it's a trifold that they can put in their wallet, and they can list all of their medication prescribed by all of their doctors, including the over-the-counter medications. We also can recommend that patients use a pill box. This is a very cost-effective way of them remembering to take their medications at the time that they're supposed to take them. As urologists, we and our staff have a responsibility to discuss with patients about their compliance with their medications. And begin with an open-ended question. How are you doing with your medications? And let the patients tell you. They don't take the medicines, they're too costly, or whatever the situation is. What else can we as urologists and our staff do? We can provide educational materials to our patients. So what can we urologists and our staff do to help patients with their compliance? We can provide them with credible educational material. That doesn't include the package insert. Rarely do patients read from the package insert, and this is not good information that they can use in language that they understand. We can provide educational materials. Perhaps we only use between 10 and 20 medications most of the time. We can give them frequently asked questions regarding those 10 to 20 medications when we provide them with a prescription. Also, these FAQs, or frequently asked questions, are available, easily downloadable on the internet, that you can provide your patients with your letterhead at the top. Also, we do a great service to patients by giving them the costs of medications at local pharmacies. This is very appreciated by patients, and the amount that they can save is anywhere from 1/3 to 2/3 from costs of one pharmacy to another within the same zip code area. We also can recommend discount pharmacies, and we know that there are a number of those, particularly for drugs for treating ED. We can find good, reputable discount pharmacies to recommend for our patients. Also, it's a good idea to include the pharmacist as part of our team in enhancing compliance. Practices that partner with their pharmacists can improve adherence and outcomes by over 2/3 if the pharmacist gives information and instructs patients and gives them reminders for refills so there are no gaps in their medication. The bottom line is, as I told you in the beginning, a whopping 125,000 deaths per year as a result of poor compliance. As urologists, we can improve compliance. Urologists can make it happen, and we can put a dent in those 125,000 deaths per year. If you have any questions or concerns, or you have suggestions on how to improve compliance for your patients, kindly let me hear from you at this address. I look forward to chatting with you again in the near future. Thank you.